My specialty is osteopathic neuromusculoskeletal medicine. My areas of interest are pretty far-ranging, so I see patients for hands-on manipulation and diagnostic and treatment care, basically from birth to the very end of life. Everything from difficulty with breastfeeding and torticollis to arthritic chronic pain, as well as pregnant women with low back pain and post-op ileus in the hospital. I also treat athletes of all ages, so from competitive middle school, high school, little league athletes all the way to, I have a ballerina that I treat, she's 50 years old and still dancing. So any of the musculoskeletal injuries that one might sustain with having a competitive or active lifestyle. I am there to listen to their life experience. What traumas have they sustained? What injuries have they sustained? How many surgeries they've had? Are they exercising? What kind of work do they do? Both in the house, out of the house, professionally, recreationally. After that, I do an osteopathic examination. I run my hand from head to toe and feel with my hands, what does the body feel like? Are there really tight muscles? Are there hypermobile joints? Then with the patient's permission, I do a treatment with my hands. This is usually a very gentle treatment to help align the body. What makes this rewarding is to know that I made a difference.